This is the overall CPG for pain relief and the associated conditions where you can give each drug. Okay, today we're talking about drugs and in particular pain relief. So in Ambulance Victoria, these are our options. So the first one is Penthrain. It comes in a little glass ampule and you pour it into an inhaler and it becomes an analgesic for the patient. It's otherwise known as the green whistle. Patients inhale at one end and it gives about 25 minutes worth of pain relief. Good for fractures, musculoskeletal type injuries, and
severe headaches also.
This is the Penthrain CPG and the associated contraindications. The next one is Fentanyl IN. It's good for paediatrics because it's fairly non-invasive. What happens is the fentanyl is
drawn up, the correct dose is drawn up out of this vial, and it's already been placed into here at the moment, and this is placed under generally the child but also adults' nostrils, and it is injected into both nostrils.
This is the fentanyl CPG and the associated contraindications. The next one is fentanyl IV. It's usually a sort of last resort. It comes in a little glass ampule and then it's drawn up into a syringe.
Yep, this one's already been drawn up, so once the person has been cannulated, this can just be inserted into the cannula and injected.
The next one's morphine. It's fairly common, easy to administer. Saline is drawn up first, 9 mils, and then 1 mil of morphine into a syringe, and then it's administered IV to the patient.
As with all drugs, it's important to check that you have the right drug, the right volume, and the right expiry date with your partner. So we've got morphine, 10 milligrams, 1 mil, expiry 2019.
No problem.
So that gets mixed with the morphine and is then inserted into the IV.
This is the morphine CPG and the associated contraindications. The next one is Maxilon, and this is usually administered if patients are going to be slightly sensitive to morphine. It can also be administered if it's any nausea or any vomiting associated. It comes in a little plastic ampule. It's drawn up into a syringe, and it can either be given IM or IV.
And it's also particularly important to be given to patients who are going to be spinally immobilised, as we don't want them being sick, because as they're going to be immobilised, they can't move.
This is the Maxilon CPG and the contraindications. The last one is naloxone, so Narcan. This can be administered if by accident you have administered too much of a narcotic.
Or the patient has had some sort of adverse reaction to it.
Yep.
So either your morphine or your fentanyl.
So it's It's given IM, and it can reverse the symptoms of other narcotics.
It's also used in heroin overdoses as well, if you attend those too.
This is the naloxone CPG and the associated contraindications.